Understanding Medicare in Wisconsin, a helpful guide created by Insurance Advocate Services. What is Medicare? Medicare is a health insurance program administered by the Federal Centers for Medicare and Medicaid Services, also known as CMS. Medicare is divided into 4 types of coverage: Part A, Part B, Part C, and Part D. Who qualifies for Medicare? People aging from 65 or older, some individuals with disabilities under the age of 65, and of course, excluding cost plans, people of any age with permanent kidney failure or Lou Gehrig's disease, also known as ALS. Enrollment periods. The annual enrollment period starts on October 15th and ends on December 7th. The open enrollment period, or Medicare Advantage open enrollment period, is from January 1st through March 31st. And the special enrollment period, which is a window in time in which you can sign up for or switch Medicare Supplement, Advantage, and Part D plans outside of the normal enrollment period. This can be due to circumstantial changes or even becoming Medicare eligible. Medicare Part A, also known as hospitalization insurance. There are no premiums for Part A, as it is free as long as you have worked for 40 quarters or 10 years. Part A pays hospital bills, certain skilled nursing facility expenses, and provides limited coverage for skilled nursing care after hospitalization, rehabilitative services, home health care, and hospice cares for those who are terminally ill. Of course, excluding custodial care, which is help with eating, dressing, or mobility. Part A begins on the first day of your 65th birth month. If you are born on the 1st, the coverage date would begin on the previous month. Medicare Part A continued. The period of hospitalization is called the benefit period. The benefit period begins on the day of hospital admittance. Benefit period ends when you have been out of the hospital or nursing facility for a consecutive 60 days. If you are readmitted within the 60 days, you are still in the same benefit period and would not have to pay another deductible. If you are readmitted after 60 consecutive days, a new benefit period will begin with a new deductible needing to be paid. Medicare Part B. Part B is most commonly known as medical insurance. This helps pay for doctor bills and other charges, including surgical care, diagnostic testing and procedures, some hospital outpatient services, preventative services, laboratory services, physical and occupational therapy, and durable medical equipment. Part B continued. Unlike Part A, Part B requires a monthly premium. For the year of 2025, the premium is $185 per month. This price changes every year, so be sure to ask your broker about future price changes. Another aspect that differs from Part A is that a request for a start date will be needed for Part B. Part B also can be automatically taken out of your Social Security check monthly or billed directly, whatever you would like to do, as it is your choice. Medicare Advantage, also known as Part C. This provides medical coverage through private insurance companies. It has a bundle of all Medicare health benefits, with or without RX, or most commonly known as Part D, with extra services like vision, hearing, dental, and even fitness plans. Medicare Advantage, or Part C, continued. Part C may include deductibles, coinsurance, and copayments. And in-network doctors and hospitals may apply. Medicare Part D Prescription Drug Plan. This helps pay for inpatient and outpatient prescription drug costs. Only the cost of drugs covered by your prescription drug plan will count toward the out-of-pocket limits and deductible. Each plan has a different formulary. This is the list of drugs covered under your plan. Generic drugs are covered under most Medicare Advantage plans. Although it is a voluntary program, if you do not enroll in Part B plan or a plan with RX, you may be subject to a late enrollment penalty in the event of not having credible coverage during this time. You might even have to pay a penalty if you decide to sign up after your eligible enrollment period ends and there were 63 days or more in a row when you did not have either Medicare drug coverage or other credible prescription drug coverage like senior care, group employer plan, or veteran benefits. The penalty is equal to 1% of the national base beneficiary premium for every month you wait to enroll. This penalty can stick with you for life. Every year, your drug coverage should be reviewed to be sure your drugs are listed on the formulary, as it can change year to year. Part D Assistance Programs. Senior Care, a state program through the Department of Health Services and Division of Medicaid Services for residents of Wisconsin. LIS, Low Income Subsidy, or Extra Help. LIS can be applied for through either the Social Security Administration or at your local Medicaid office. Medicare Supplement Insurance, also known as Medigap. This is a private health insurance designed to help cover certain out-of-pocket costs that are not paid by original Medicare, Part A and Part B. Medicare Supplement Policies. They provide you with coverage for some of the costs that are not covered by Part A and Part B. Eligibility begins within the first day that you are enrolled in Part B for up to 6 months, regardless of health history. After the 6-month period, the underwriting process will be needed. A claim submission to insurance company might be necessary for payment of services as well. Medicare Supplement Policies continued. Part B expenses are paid at 80% of the Medicare-approved amount. Medicare supplement policies may be purchased from insurance companies to cover the remaining 20% of Medicare-approved expenses that are not covered by Medicare. Medicare supplements have higher premiums, but less out-of-pocket charges. There are many advantages to having a Medicare supplement policy. Some of those are optional riders, which is a choice from various riders to add specific benefits to their base policy, allowing for personalized coverage. Guaranteed renewable. As long as premiums are paid, Medigap policies in Wisconsin are guaranteed renewable, meaning the insurance company cannot cancel the policy. Open enrollment period. This is slightly different than the other types of plans, as you have a 6-month period that begins the month you turn 65 and are enrolled in Medicare Part B. During this time, you have a guaranteed right to buy any Medigap policy offered in Wisconsin without medical underwriting. Comprehensive coverage. This helps cover out-of-pocket expenses like deductibles, coinsurance, and copayments that original Medicare does not pay. There is nationwide coverage, no network restrictions, so you can see any doctor or specialist who accepts Medicare without needing referrals, and protection against high costs. Of course, there are some disadvantages of a supplement policy, some of those being Part D is not included, which means you would need a standalone prescription drug plan. High premiums, limited to original Medicare. Medigap policies work only with original Medicare and cannot be used with Medicare Advantage plans. and they do not offer dental, vision, and hearing, although some discounts may be available for these services. Cost plans, offered by private insurance companies, flexibility and choice of providers, and it works with Original Medicare. Cost plan advantages, flexibility on provider choice, optional prescription drug coverage, meaning you could either have a PDP or a plan with RX included, and year-round enrollment. You can join or leave Medicare cost plans at any time, unlike Medicare Advantage plans that have a strict enrollment periods. Disadvantages with a cost plan. Limited availability. Availability is geographically restricted to certain counties. Higher costs for out-of-network care. And possible higher premiums. Premiums can be higher depending on what region you are in and what plan you choose. What is an HMO? An HMO is a health maintenance organization. You must receive all services from an HMO contracted medical provider or a referral to see a doctor outside of the HMO network. Of course, this excludes emergency care or urgent care situations, as a referral will not be needed. Advantages of joining an HMO. With an HMO, you have a choice in a designated primary care physician, as well as you have a network of providers available to you to be able to coordinate your care. You must choose a provider within the network. If you need to see a doctor outside of the network, a referral is a must for the visit to be covered. As well as those, you have lower monthly premiums and lower deductibles and copayments. Disadvantages of an HMO. There is a chance for higher out-of-pocket expenses. Coverage for emergency situations must meet certain conditions. You must only use in-network providers to obtain coverage, as well as referrals. What is a PPO? A PPO is a preferred provider organization. It partners with a group of clinics, hospitals, and doctors to create a network of preferred providers. You can still see out-of-network providers, but you will receive the most coverage within the network. This is great for people who live in more than one state, like snowbirds, or those who travel often. Advantages of choosing a PPO. There is a large nationwide provider network. No referrals are needed. There is out-of-network coverage, and you are not required to choose a primary care provider. Disadvantages of a PPO. There are higher out-of-network costs, possible higher premiums and copays, and fewer plan options. The more you know. Understanding Medicare begins with these simple steps: knowing when you qualify, enrollment periods, obtaining Parts A and B and understanding what they do, knowing when Part D is needed and the repercussions of not having Part D, defining Medicare Advantage, Part C, Medicare supplement policies, and cost plans, and finally, understanding the difference between HMOs and PPOs. These are all great starts to becoming knowledgeable in your healthcare choices as you become Medicare eligible. Meet our team. At Insurance Advocate Services LLC, our mission is to empower our clients with peace of mind through tailored insurance solutions that prioritize their unique needs and aspirations. We are dedicated to fostering lasting relationships built on trust, transparency, and exceptional service, ensuring that every individual and family we serve feel supported and protected. Together, we strive to enhance the well-being of our clients by providing not just coverage, but a partnership in securing their future. With our 3 locations, We are readily available to assist your needs. Call or email for an appointment today. This is Shane Benoit. Shane is licensed in Wisconsin, Minnesota, Florida, Arizona, South Dakota, North Dakota, Michigan, Illinois, Tennessee, and Idaho, offering no-cost assistance, whether it is for Medicare, health, dental, vision, hearing, annuities, life, home, auto, business, or final expense insurance. Whatever that may be, Shane is here to help. Now let's meet Megan, the newest member to Insurance Advocate Services. She is the office manager and broker, most commonly in the Hudson office from 9 a.m. to 5 p.m. Monday through Friday. Our Hudson office is open from 9 a.m. until 5 p.m. Monday through Friday. Our Minong office is open 9 a.m. until 5 p.m. on Thursdays and Fridays. And our office in Gilbert is open upon request out of convenience. Walk-ins are always welcome.